Hello, sir. So, getting my
Hi,
voice?
Parth. Hi. Good
Hi,
evening.
sir.
How are you?
Yes. Yeah, doing good, sir. What about you?
I'm good. Thank you.
Hope you are in home, sir. Right?
Yes, I'm at home. Yes. Yeah.
Okay. Yeah. Thank you so much for giving us time, sir. Giving me a time.
No problem.
It's, few things generally this I will do for because of my curiosity on public health, how things going wrong and where people are doing mistake or any system is mistake or something. That's what
Yeah.
my curiosity. Out of which I will have few questions, sir. So my primary question is, sir, in the population, whether heart diseases are increasing in the current generation?
No, that's a very good question that you had put across.
Yeah,
Is it because we are identifying more or is it actually more?
correct.
So that's a good question.
Yeah.
It is a bit of both, but definitely there is a lot more heart attacks than
Okay.
we knew from before.
Mm.
If you look at every family,
Mhm.
they have somebody who has either died or who has suffered a major heart attack and the consequence. So that is not just simply because we are identifying, because previously, if we didn't identify, they may have died and we would have assumed it's heart attack. So many times, heart attack, the fact heart attack kills is very well known for decades. So
Okay.
for nearly 50, 60 years. So it's not like we are new to the concept of heart attack. So
Mm.
people will know heart attack, particularly the ones that kill people. They will know.
So you're on mute.
Therefore, I don't think it's purely a matter of increased awareness and identification. Yes, there is that. But more importantly, we clearly are seeing more heart attack in different age groups and different types of people where previously this was not common. So if
Okay.
young
You
people,
mean say
healthy people,
yeah,
yeah,
young generation having a lot of troubles. Yeah.
major risk factors, young women heart attack and all was unheard of. And
Correct.
until when they are having their menstrual periods, women are protected by their hormone estrogen, and
Okay.
they won't usually have high blood pressure or
Correct.
heart attack. Now we are getting all of that. So clearly there is an increase in high blood pressure, increase in diabetes,
Correct.
and a very high incidence increase in heart attack, no doubt.
Correct. Yeah. Thanks for the clarifying, sir. Actually, yeah, I also my understanding also, it's happening both. Like the health is deteriorating more, and the detection also more. Yeah, it may be. That's why both things happening parallelly. And as you already discussed in your videos, that what is the major reason for heart attacks nowadays, sir? There may be a lot of reasons,
Yeah,
but the
no,
major
one is
reasons you want to
we
discuss.
define them as conventional risk factors
Mm-hmm.
and unconventional or a new risk factor. So the conventional ones are sugar, BP, cholesterol, smoking,
Mm-hmm.
family history. If anybody, any member of the family, particularly male member of the family at a young age had a heart
Correct.
attack, then they are at and the rest of them are at high risk, and all these conventional risk factors that we know. These
Conventional,
conventional.
yeah, conventional, yeah, agree, sir. Convention is fine because it's since very long time. Uh, if the person is having few diabetic kind of things and the cholesterol increases, that is natural. That everybody could understand that and they're able to understand if you talk about it. But nowadays, if you take example of uh,
That's what I'm saying, unconventional. So that's
yeah,
what I'm coming to the
yeah,
unconventional one.
yeah,
The unconventional ones are the ones which are worrying us
yeah.
because the conventional ones we know and we can fix them because we look for them, we identify, we fix. The unconventional ones are the reason for the new surge in heart attack. And if we don't identify them, if we are not clear about what they are, which we are not at the moment, we
Mhm.
will still continue to see this high heart attack rate. So it
Okay.
is very urgent and important to identify what these are. And the ones that I know are number one, stress.
Mhm.
Stress has become very high in the agenda of heart attack now. Stress is one reason. Lack of sleep or poor quality of sleep,
Mhm.
chemicals in food, environmental pollution,
Okay.
these are all the things that are new unconventional risk factors, which are not yet clearly identified and therefore difficult to say this is why you had a heart attack.
Correct.
And
That
when
is
we
clear gray area for even doctors as well, right? That's what I
mm,
also felt.
mm.
Good, sir. So in the same unconventional way, unconventional heart attacks you talked about, is something due to the electrification changes in the heart? Is that is new, or it was the previous in a conventional method also?
What do you mean by electrification changes?
Like,
The ones that I
the
talked about is
pacemaker, yeah,
yeah.
suddenly pulse will increase. If a sudden, it will spike to 300
No, no, no.
times per.
They are two very different things.
Mm-hmm.
So that is electrical problem. This is plumbing problem. This is blood flow, and that is electric.
Okay.
So that when somebody gets a heart attack, they can get an electrical disturbance which can stop the heart, which is usually how people die of a heart attack. And that is when they have a heart attack, the
Mm.
heart will suddenly go to something called ventricular tachycardia, ventricular fibrillation. Suddenly, it will go really fast and stop. So
Correct.
that is there. But that itself, the fast heart beating itself causing a heart attack is extremely rare. It doesn't do that.
Okay. Mhm. So major problem is because of blocks in the
In the
vein,
artery to
right?
the heart. Yeah.
Artery things.
Yeah.
So yeah, let's come to that point, sir, because I can see even in my family also there are diabetic patients. So there is more risk of heart attacks for diabetic patients.
Mm.
That's what I heard actually.
Mm.
So actually, what causes of blocking the vessel of in artery
It is
for the hearts?
deposit of cholesterol inside the artery.
Mm-hmm.
But why does cholesterol deposit into the artery?
Mm-hmm.
One reason is high cholesterol, but not the only reason. There are a number of other reasons, which
Correct.
is where all the risk factors come into play. The
Mm.
artery, inside of the artery, will be very smooth normally. When the artery in the inside becomes rough, then even normal amount of cholesterol can go and settle in and become and repeatedly keep falling in that area and block. The
Okay.
typical example is smoking. So
Mhm.
smokers have rough arteries. The inside of the artery becomes very rough. So
Okay.
even if they have normal or low cholesterol, they can still build up cholesterol in the area where it is rough and
Okay.
then cause a heart attack. So that is
Okay.
there are multiple factors, but it is usually cholesterol depositing into the heart.
Okay. So the cholesterol, sir, this is where I surprised. The reason, so let's say cholesterol is traveling in a blood, maybe in form of triglycerides, uh, that may be in form of saturated fats that we generally talk about. It's a bad cholesterol, right? So how can it become hard inside the body? Let's say cholesterol is
No, no.
kind of.
What happens is the roughening of the artery
Mhm.
then causes the cholesterol to go and stick to that artery.
Correct.
Once it sticks there for some time, and then it goes through various process called atherosclerosis. So it's a combination of cholesterol, some inflammation, some soreness, some blood products, everything building up. It's a bit like your kitchen sink. Okay,
Correct.
you keep washing and putting things down. Number of things keep adding on to one another, and then that is what forms the bulk of the block. The block is a little mountain which is predominantly the base is cholesterol. On top of that, a lot of other calcium and
Correct.
all that stuff sticks to that. And when
Yeah.
they all stick to that, they become hard.
Yes, that's where I want to come talk about the calcium as well. Let's say, uh, is the really the saturated fats and calcium get together and become hard? The block, whatever the
Yes, I mean,
cholesterol.
the fat deposits, as I told you, it is a very complex process. It is not very simple to
Yeah,
explain.
correct, correct.
It is a complex process.
Yeah.
Once the first step is fat sticks to the arteries.
Mm-hmm.
And after that,
You're on mute, sir. You're on mute. You're on mute. Mute.
so that area becomes sore.
Mm-hmm.
And then because it is very sore, it attracts blood cells which come into that area called macrophages. And those cells will come and try and eat away that area, and it will not, and it will accumulate. Then there is something called fibrin in the blood, which is a blood product that will, like a string, like a little rope, that will come in. And then there are certain cells called platelets, they will come and stick. So, number of little things will stick together to make that little bulk there. But on top of that, calcium. When calcium comes and settles, it becomes like a rock. It
Correct.
becomes like a hard
That is
rock.
where it become very complex, right? For
Mm.
blocks, yes. So, what causes the calcium come to the vessels? Like,
All of us have calcium in our blood. We should be having that. All of us have calcium in the blood because cholesterol is fat. fat will always stick to calcium easily. The
Oh,
calcium, or rather, other way around, calcium will easily stick to the fat, the fat in that area. For some reason, somehow diabetics seem to be more prone for this process of calcification of the cholesterol.
cholesterol, right?
So, the cholesterol will get into the calcium will mix with the cholesterol and become like a rock.
Correct. So my understanding, sir, let's say every person will have a calcium in the body, and people are giving calcium tablets like left and right for women, especially after
It
menopause.
is not about how much calcium you have.
Yeah.
The fact you have more calcium in your body doesn't make the vessel calcified
Okay.
at all.
Yeah. No.
So you won't do any harm by giving more calcium. No.
Okay. So somehow the body not able to absorb the calcium, sir. It's somehow bones are becoming weak for so many elders.
Well, that's a completely different topic to talk about. Why do we get low calcium levels and why do we get
Okay.
weak bones and
Okay.
osteoporosis and osteomalacia and all that? Particularly after menopause,
Mhm.
women are very prone for developing weak bones,
Correct.
and
Correct.
um, and so they need to
Okay.
either
There
get
is
a
no
hormone.
relation. There is no relation
Yeah,
to this, right?
no,
Okay.
no, no.
So it may happen even for youngers. The calcium
Yeah,
can. Yeah.
yeah.
Correct.
Calcium amount of calcium you consume has nothing to do with calcium going and depositing in these areas.
Okay.
These areas, but even if you had very normal calcium, if you had that area which is sore and full of cholesterol,
Okay.
calcium will stick.
Okay. Okay. Got it. Okay. So, yeah. Let's move to the next. That I heard saturated fats are bad fats. So it will increase LDL cholesterol inside the body, and it will LDL itself is a bad fat. So this is the medical industry will measure. Uh, so do you think it is really LDL or saturated fats are bad to our body, or it is labeled?
So there's absolutely no doubt about that. There should never be any doubt. There has been more than 50 years of research into it. We
Okay.
know, I mean, nobody ever questions that LDL is bad.
Hmm.
What we now know is even when we control the LDL very well,
Hmm.
still people are getting heart attack. So now we are looking for what other fats are bad for us. So the
Oh,
triglyceride is one thing you mentioned. The triglyceride is
triglyceride.
another. And now we are very aggressively controlling triglyceride as well, particularly in diabetic people. Triglyceride will be very high, so we are aggressively controlling that. There are 3 or 4 major drugs which are available. We use that. Now we know that even with those two controlled, that leads to a further small density or the low density lipoproteins and stuff like that. They are
Oh,
all available. So
oh,
chylomicrons, low density lipoproteins. So there are various other fats which are still harmful despite controlling LDL and triglyceride. But these two are the main. LDL and triglyceride definitely are the main villains in the process of the heart attack.
okay. You're saying even the LDL level is low, still people may get heart attack in different forms. Okay. Mhm. Okay. So, I want to ask you, sir, regarding the doctors community, that always it's a practice for doctors community because the new things will come in and new learnings will come in. Few things may go bad in past. So I want to understand, doctors, any, let's say you are specialized in heart related treatments or procedures. Do you think the heart related things, anything you misunderstood before, let's say 10 years back or 15 years back, and now the industry is corrected?
Yeah,
Anything?
medical profession.
Yeah,
Yeah, I got your question. So
yeah,
medical profession is continuously developing, and
correct,
like any other profession, when we are developing, we unlearn the old and learn new.
correct, correct,
So there are times when we have to say something we thought in the past is good for the patient is no longer good,
correct, correct.
and
Yeah,
uh,
that's what.
it does happen. It does happen definitely, not on a daily basis, but it does happen. Certain drugs that we might have thought is very good for the patient,
Hmm.
now we either have something better or that drug is no longer good and we have to change the patient from a different one because our knowledge of that
Hmm.
drug and its use has changed and improved.
Okay,
Therefore, it is an everyday process that people go through.
okay,
There has never been anything major which was previously used as a treatment, which then became a harm or a major damage or
correct.
anything like that. That
Okay.
is rather unusual.
So there is, it's everything is research oriented and proved. Then only it is coming to implementation, right? Yeah. Another question, sir, regarding the academics. I observed so many doctors community. Uh, they came out from the colleges after practice. They will have a 6 months or 1 year outside practice, villages or something, and they will come out and they will have new clinics or hospitals. And I observed there are so many doctors stagnated their knowledge and use the same thought process for treating the same diseases. So, what do you say about that, sir? Do you think any
It is,
change
it is,
required?
it is true. You're right. It just happens worldwide. Now, I was in the UK for 18 years, and in the UK, one of my colleagues, very senior guy, and he always believed he knew everything because he never updated.
Correct,
And
correct.
he finished his
I
degree, and then
faced.
for 20 years, when we, two, three of us youngsters, we were updating continuously, and we know how little we know because every day we know things are changing. And
Correct.
right now, half an hour ago, I was on a big group of discussions about how we have looked at cholesterol, and there is something very new coming on as LDL, which is
Oh,
a small LDL, and that
correct.
is even more dangerous than the LDL. And we are talking about all of that.
Okay.
And people who don't know, they are blissfully happy. They think they know
Correct.
everything, and they keep writing everything. And then they also try to convince the patients they know everything.
Yes, yes.
So this is a serious problem.
Yeah.
Certain places like the Western country, what they do is they make it mandatory for people to update, and they have to show that they are updating by taking a little exam type thing on a regular basis. They have to keep doing that. In the
Yes,
US, it is there.
yes. That
In
is
the
there.
UK, it is there. But in India, it is not there. Very recently, the medical councils have brought up. They have actually, it is there actually. They
Mm.
say that you need to have at least attended 30 hours of medical conference in 1 year so that you're updating your knowledge.
Correct.
So
That
we
is
have
there.
to update all of yeah.
If that is actually come to the picture and actually come to
But what
implementation,
happens? People register for the conference, they go eat the biryani and drink the wine, and then they go out,
that is
and then they
yes.
don't listen to anything that is being
Definitely.
talked.
Even in
So
our software, I am software engineer, right? So even for us, there will be yearly trainings for new
mm,
technologies. Company will make it as a mandatory, and
mm,
you have to update that. Okay, and what people do that they will sit in one place and everybody sit together, and if one guy know one question and he will tell to everybody and they will just mark it and close it. It never been as
mm.
serious, but
I know they don't take it seriously at all. They don't understand why. They don't understand the reasoning behind it. They don't
correct.
understand why this is important.
Yes,
So it's very difficult to it's a socially conscientious thing to do. And now
correct,
it's very much like throwing the wrapper after you eat your chocolate. Now,
correct.
if you're a socially conscientious person, you will throw it in the bin. If you're not, you'll just throw it on the street
Yes,
and go.
correct.
The same
Yes.
concept applies here.
Yeah,
So
even
that is how it
repeating things also a feed to the brain, right? So always it will be in a memory
is.
if we
Totally.
are
Yeah,
repeating the
totally.
things. So that is the
Mm.
concept behind that, maybe. Yeah, if that is coming in doctors' community, hope I will be happy that it may improve better.
They're
And
trying. They're trying to implement it. They're trying to implement it, and
okay.
also, and they're trying to implement it. It is true very much that some people, not some, a large section of doctors,
Mhm.
don't continue in the academic setup. So they have their own clinic, which is okay. They have
Correct,
their own clinic, and they're doing patient practice, and they're seeing their patients. So they are their own quality control. There is no quality control for them.
correct.
So that is where the problem begins and ends.
Yeah, it's
So they.
unregulated. Yeah, unregulated things.
Mm,
Other things, sir. Let's say a doctor, one patient came to a doctor and he has seen some, let's say, heart related things. Okay, and he had some pain on heart or something. Okay, doctor checked and with the reports, help of some scannings or something. He find that there is no problem, and he sent the patient to the home. Okay, and giving some pain relief, or if the cholesterol is high, they may give some statin drugs and all, right, if it is serious. So they give and they send patient to the home. Okay, and here in this case, suppose a patient became serious after next day, after came back to home, next day it became very serious, and the same patient went to some other bigger doctor, what he may think is big hospital or something, and he get the treatment there. Okay, and the very first doctor he came and visit, and he may think that whatever I given the treatment, it worked for him. Okay, and he became well because of my treatment. So he is not getting treated. getting feedback that his treatment is didn't work. Maybe his understanding could not proper for the same treatment. So how this will be dealt in the medical industry, sir, medical community?
Yes, no, it's a good question. As in, how do we know what? How do we know what we have done is right or wrong, and
Correct,
how do we how do we quality control ourselves? As you said,
correct,
that's one. It's a very difficult thing in India to practice because we don't have a system in place. In a Western country where there is several tiers, so the GP sees the patient, sends the patient to the next consultant, sends the patient to the next consultant. So there is a chain. So you can
yes,
always trace through the chain and realize that the GP has missed, and which is why you see in the newspapers that the GP has missed this, GP has missed that. In India,
correct.
we don't know who has missed what because
Don't know
we
the
don't even know.
terminology itself.
Exactly. You don't know the
Yeah.
terminology of who
Yes,
missed what. Yeah,
correct,
exactly. So, yeah, therefore, missing things is a very commonplace thing in medical practice because when the mind does not know, the eye will not see.
correct.
So, more, not let's say, what a cardiologist can see in an ECG
Mhm.
versus what an MD doctor can see in an ECG and what an MBBS doctor can see in an ECG will be very different. And
Correct.
that is nothing wrong with that. There's nothing wrong with that because that is their level of understanding, their level of expertise. So there's not a problem.
Yeah,
But to say that I don't know what this is and I want to send you to someone who knows what this is something that is not at all practiced in India,
correct.
which is a sad situation.
Yeah, I
So
observed. I observed most of the doctors they don't like to say that I don't know, right?
hmm,
Yeah, this is
they
what.
believe that if they said that, then the patient will lose trust and therefore they
Yeah,
will go to
correct.
another doctor,
Yeah, he
and
may
so
think
they will
that.
lose the patient.
Yeah, he may think I cannot retain the patients. I heard from
Hmm,
the doctors, if I do this, I cannot retain the patients. The
hmm.
statement itself is a unethical. What I felt, but
Yeah, no, totally. No, I agree with you. There are many times when I have said that
mm,
I don't know what this is because this is not cardiac.
mm,
Okay, you're not like right now. I have a patient that his daughter is calling me on the phone again and again. So two, three calls
correct.
has come from her. Her father is vomiting all the time,
Mm,
and I'm not a gastro doctor. I don't know why he is vomiting. I have looked at all the common reasons. I have done my MBBS, I've done my MRCP, I've done everything
yeah,
within my knowledge. I have done all the tests I can. I can't find a reason. I've asked an expert opinion, and the expert is asked for another 15 tests. And she's saying, "Look, I don't want anybody else. You just treat my dad and make him better." But I told her, "Look, I don't know what this is. How am I going to treat it? I don't know."
yes.
And therefore, it is important that we get the right expert to
Mm,
see and let them decide what this is, and that is what it is. So I don't think people lose respect. Actually, they respect you more if you say that.
correct.
Listen, I am.
That's what my
Yeah, yeah,
point. Let's say
yeah.
instead of saying I lose the patients if I say I don't know, instead of that, people respect if you say I don't know, right?
Mm.
And
Yeah.
the best example that my father, he expired on 2016, and he was a cancer, liver cancer, and liver spread to the lungs. Okay, and he was treating in a some allergic hospital. He was taking the X-ray of the lungs. Okay, and he's just saying that there is nothing, and he's just giving the tablets, and he's not recovering at all. Later at the final stage, we somehow in Bangalore we identified, and that is different story. The initial doctor, whenever he treated the lung disease, whenever he got a cough and all, if that is the case where doctor suspected and he said don't know, then we might have saved him. Okay, that's the cases where I can see a lot of things. And the X-ray, that is the different story again. The X-ray, what he has shown us, that time I didn't understand. I don't know that time nothing regarding anything medical things. Now, if I see that X-ray, it is just like a black cover. There is no details. It's not bone details also not properly captured. It may be different things. Yeah, that's where the things going wrong. And I want to one more thing, sir. Let's say a non-medical person, let's say one person uh, like me, okay, came and say something in a public like this is something is wrong happening in the industry, maybe in doctors or any industries which is not related to the particular person, say that this is something going wrong in the field, let's say medical field, and you doctors may need to look at it for corrections. So how the doctor community receive it? Whether they will receive it or they may think that
Criticism, we criticize the politicians, we criticize the actors, we criticize the cricketers, we all criticize everybody. So criticism
correct,
is common.
correct.
So everybody should be open. Everybody should be open to criticism.
Yes,
So when the criticism comes from outside the community, wherever there is, it is less. It's seen as less justified because they think that what do they know? Okay,
correct.
what do they know? What is it? Say for
Yes.
example,
And
in a
I heard from
cricketing
a
field.
doctor that you don't know medical
Hmm.
terminology. She said directly that
Hmm.
you don't know, non-medical person may not know the medical terminology and all. But definitely we don't know the medical terminology, but we will have a logics.
Yeah.
Maybe let's say
Yeah,
I made a logics.
totally. Yeah. So we don't know politics, we don't know cricket. I don't play cricket, but I do
Correct.
still comment about the cricket.
Yes,
That's how
yes,
they managed to
yes,
lose or they managed to win or whatever. So
yes,
we are no. Therefore, we can't. So therefore, it is not a reason to say that somebody shouldn't criticize.
yes.
And in terms of how the medical field looks at it, many times doctors tend to be defensive,
Correct.
and
That's what
yeah,
my
many times
opinion also
that is
saying.
not again necessary because being open to criticism will again gain a lot of respect.
Yes, it
And
is just like, let's say, a farmer. If he want to do a farming, he has to go for he has to go agriculture degree. Unless he has an agriculture degree, he cannot do farming. It is similar to that, right? So no farmer will have a degrees. Still, they will do agriculture.
yeah,
So this
that
is
is slightly different. That's
yeah.
slightly different. But in terms of commenting about somebody's performance,
The
if it
commenting
is
is fine,
criticism,
sir. Commenting is
no,
I'm not talking about
no,
commenting.
criticism about performance or criticism about practice. I
Yeah.
think anybody should be able to do, and everybody should be open to it and receive it openly and see. Say, for example, you could come and tell me today. Now, you could come and tell me today that I know what. Now, I was waiting for the last 1.5 hours to see you, and it's too long to wait.
Yes.
And I can either get irritated with that and say, "How do you know about my work life?" And I'm a doctor, and or I can tell, "Look, I understand how you feel because you know what? There was an emergency. There was somebody who actually had a heart attack. I had to go and deal with that, and that is the reason why it's a little bit late. I'm so sorry."
Yes.
Okay, so the criticism there suddenly becomes once the explanation is given, the criticism suddenly gets understood.
You
It
understand?
becomes
Yes.
understood.
And
Yeah, that is.
not only criticism, sir. There are the criticism also. There are two types. Criticism with logic, a
Hmm.
right way of logic and right way of thought process logic. That where doctors not able to receive it, maybe because of their academic background, the way the mindset is built from starting onwards. That's fine, sir. Actually, regarding health, overall public health, what is your opinion, sir? Like the people are going in a right direction now. We can see the public
There
is
is a lot of
little aware.
awareness. There's a lot of awareness about health now,
Hmm.
and people are very interested. I talk a lot about good, healthy eating, exercise, yoga, meditation, stress management, and all that. I'm talking to my patients. So there is a lot of interest. They listen carefully. They are very interested. They are, and also I see a lot of, at least in the educated urban population, I see a lot of
Yes,
actions taken as well.
at
They
least
go to the gym
yes.
regularly, yeah, go to the gym regularly, eat a bit more healthy, and all that is there.
Hmm.
So there is clearly both awareness and action, but it's not enough.
It's
It's
not enough.
definitely not enough.
Not enough. From the public side, we can understand that their understanding in medical terminology is absolutely zero. I know that even I am master in computer science. I know zero about medical things. That's understandable, which is unrelated. But I was expecting since long time there should be a better contribution from doctors community. So
To educate the public.
yeah, better contribution from doctors community. Like you said, there should be a 30 hours of training every year. So if those systems come into a picture and not sure what can change. I'm completely not aware about that. And within the doctor community itself, they can evolve these kind of process maybe. The outside people, they don't know much. So I'm hoping that, sir, in near future, we
So,
may see better medical
so
system.
increasingly, there is a new. We need to evolve a field, particularly for India. We need to evolve more doctors who are interested in preventive health, preventive care rather than treating. So preventive care, preventive medicine should really become important. Focus should go there,
Mm.
and more money. Money also should be. You know, they should also be able to earn a decent living.
Correct, correct.
Many reasons, many times doctors are underpaid based on what they are paid based on what they do.
Mm.
So often they're paid for a heart surgeon gets paid a lot of money when a preventive doctor gets paid a little bit, very little money.
Correct,
So if you look at the Western country, everybody's paid the same salary. So
correct.
it's number of hours they
Because
are putting in and
education and
everything.
other spendings also same for them. Right.
Yeah, exactly,
Correct.
exactly. So that's one of the reasons why doctors don't tend to. They think that it's a waste of their time because they could use their time to do something more, which will bring them more
Correct.
money.
Yeah,
So,
absolutely. That is fair enough.
so,
Yes. And
so therefore, the government policies should evolve in such a way that there is more emphasis about preventive medicine and try and promote that for Indian public. And whenever I give a talk, I always say that, and I'm going to start my talk by saying that I don't want you to come as a patient to me and end up in my table having a procedure. I would rather
preventive.
you didn't come to me. You didn't come to me and have a healthier heart and healthier lifestyle. So let us talk more about how to prevent a heart attack rather than how to treat a heart attack.
Absolutely.
So that is what we need to focus on. But it is easier said than done. But we need to try doing that more and more.
Yeah.
Yes.
So, last question, but it's not, I don't want to take much time of you. Last question, sir. So, actually, I have a complaint on doctors' community that they have the knowledge gap, lot of knowledge gap, actually, what is happening in the treatment and what actually they understood, right? And I feel the academic studies also is not up to the mark. Finally, do you believe the guidelines of international medical organizations or WHO or ICMR, any guidelines, do you believe how completely those guidelines are?
No, no. Means ICMR don't make guidelines, but most clinical guidelines, treatment
Okay.
guidelines, are made by societies, international societies,
Yeah,
and they're all
interesting.
medical societies. What they do is they sit. I used to be sitting in many guidelines committees. I still sit in committees.
Mhm.
So what we normally do is look at all the research, put all the research together, and then come up with a guideline. And we clearly say this is what is. We say there are certain things where we just say class one, and if it's class one, it means that it is the best treatment, something like that. And there are
Mhm.
certain times where we class them as 2A, 2B, etc. So that's classing that tells that this guideline is not completely 100% secure and mandate. So class one is yes, we can trust very much.
Mhm.
Class 2A, class 2B, class 3 and all that. Those class 3 is actually what you should not do, what is
Okay.
harmful. So we write that as well. So we
Okay.
put all of that in. So it is all very clear about the guidelines are clear. They always say this is something you should do, this is something you may do, this is something you should not do. So these three things the guidelines will give.
Is that
Whether people follow the guidelines or not, that is the problem.
no, that is also a other challenge. Do you think that it is not cherry picked, sir? Like the influence by medical companies or
Oh,
drug
no, no,
companies?
not the guidelines, not the guidelines.
Mhm.
You can't. Yeah, it's a fair comment because a lot of people criticize certain procedures, like the stent and all that is being. Even today, we were having a huge discussion about bypass versus stent, and the guidelines have suddenly downgraded the stent for one particular type of block in the artery, and all the entire community, the stenting doctor community, is up against, and they're saying, "How could you do that? We are also as good as the bypass surgery, this, that, everything." But there is a good reason why they have done that, and you need to understand that. So the guidelines are never influenced
Okay.
by any medical community, any medical thing. But the how you choose this, the doctors tend to cherry pick based on what is best for them as well, which
Yes.
is anyway
Whatever they
fair.
believe, whatever they want to
Yeah,
trust, they will
yeah.
trust it. Yeah. Fine, sir. Thank you very much for your time. Okay.
Same. Bye.
Yeah. Hope
Thank you.
we'll be in touch. Thank you so much.
Sure.
Yeah. Good
Sure.
night.
Thank you. Bye.